wanted to take note of that, so that you do not inadvertently create any concern. Let's put it that way.
Thank you, Mr. President. And yes, this is a fictional character, but possibly represents a prototype elderly patient navigating the health space. So there are challenges. Many elderly patients are faced making that decision. They can no longer afford private care. They have to attend the hospital or the polyclinic, and it's their first time navigating the space. It's extremely challenging. And I guess what many of us don't recognize is that there is a disconnect between private care and public care in our country. The ease of information sharing is not there. The ease of medical record sharing is not there, and so it's difficult the first consultation. Of course, being in private care, you are afforded, I would say, a more comfortable standard in terms of things like waiting time. As most doctor's office, you usually wait for just under five minutes or so for your visit. Fictional. But of course, in public service, in public care, this is completely different. And so there's some apprehension. And every time I see a relative like this with a patient like this in public care, they're extremely agitated and want to know, why am I waiting here so long? This is not what I'm accustomed to when I interface with the health system. Making it even more difficult is the fact that the health system, I believe, is not designed in its current state or at best design for elderly patients. When I trained in internal medicine 20 years ago, I very much did not expect to be practicing, one could say, geriatric medicine, because a large proportion of patients at the hospital are geriatric patients, and the type of care that is administered and also the way they interact with the health system is completely different. Let me give you an example. So let's suppose this fictional character or person arrives at the emergency room. I heard on the call-in program this morning, someone making the comment that the seats in A&E are not for relatives, they're for patients. So don't expect to come to the emergency room with a relative and get a seat. If you do, that's fine, but it's not for relatives. But many elderly patients cannot navigate a health system without a relative or some other person acting on their behalf and giving information. One thing I have never understood in the hospital space is, why is it that relatives are not more actively involved in the care of patients? I was educated I did some of my training in another place where relatives were on the wards. They had their own accommodation, they had a comfortable couch or something, and they were able to stay overnight. And as medical doctors and nurses and healthcare specialists, we were very glad when this happened, because it meant that, one, you had someone to assist in care. Basic things like assisting in feeding, or the common effect that happens to patients, usually over 65, but elderly patients, as you come in hospital, you get what's known as a sundowning effect. You become delirious, and that we're not at risk of that happening. Or we are, because we can't see sunlight outside, but because you're not seeing sunlight, you're not quite sure, and you become disoriented, and you can become psychotic in some cases, and it can be misinterpreted as an acute psychotic episode. These things are real. Now imagine a hospital, proposing opening the windows, a hospital with 2 nurses, and all it takes is one patient to be agitated, and that destroys the whole dynamics of the ward. Nothing gets done. The patients around this person are upset. The relatives are embarrassed. All these things happen because the health system has not been reformatted for sane. Imagine if this was not the case, where relatives in an open ward could be there to assist in care. Elderly patients are a lot more comfortable when they see familiar faces. I'm not going to comment on whether they prefer their food from at home versus the hospital food, but we know the answer to that as well. Maybe not cuckoo though. So, so, so this is a challenge. This is a challenge. Now, the hospital system needs to reset, but also the primary care system as well. Let's just imagine again, and bear with me, Mr. President, an elderly patient coming to any of our polyclinics. What is a system in place to make sure that they have the smoothest pathway through the health system? I'm not just speaking about designated parking spots, but I have witnessed firsthand, a poor old lady, she would approach a polyclinic. Granted, there's a security pathway, metal detector you have to walk through. She's not even sure what she has to walk through, so again, now she's confused. Maybe a relative is not with her. The security guard says, empty your bag, right? Imagine you're an older person, you're just being told empty your bag, you're not sure what's happening, right? And it's difficult, And simple things like training staff how to interact with the elderly makes a huge difference. They make a huge difference. I have caught myself several times in speaking to older patients and in raising my voice, and I'm not raising my voice to say anything, and I'm saying things to them, and they'll say to me, well, I can hear you. So again, there's a bias, and training is necessary in order for this bias to be removed. And it happens, let me say, at all levels. Doctors, nurses, pharmacists, physiotherapists, it happens at all levels. So one thing I would like to see in this policy is that there is something in it that speaks to the urgent training of the health system or practitioners within the health system as we interact with elderly patients. It is a low-hanging fruit, and it makes the experience completely different. I want to also address another matter which I think speaks more to our hospital system, and that is the fact that the elderly are also at risk from even short periods of immobility to becoming bedridden. Many instances, someone comes in with, let's just say, a flu infection or some minor infection that younger people might take 2 or 3 days in hospital and then are discharged once they're off oxygen and they've completed treatment. An elderly person cannot do that. What then happens is this person who was ambulant and fairly self-sufficient now has to rely on their relative for their activities of daily living because they can no longer walk around and do basic things. So that transition happens very quickly. Now, when you think about it, you are now saying to someone who, yes, might pass by and maybe assist in heating up some food, but is not living with that person, who now has a very dependent parent or grandparent they have to look after. And so many times, and I'm not saying that people should bring people to the hospital, their parents and grandparents, and leave them there, but I also, at the back of my mind, think this must be very difficult being faced with a new reality, that when I leave here, I now have to do all of this, plus go to work, plus look after my kids, plus all the other responsibilities. I'm torn between guilt and a health system that's saying, if I leave my mom here, you're a bad person. And ultimately, we want the best thing for our parents and grandparents. There are many times I've heard relatives say, listen, if she's at home, based on what I'm seeing that's happening here, I cannot provide this level of care. I'm not trained. She's going to deteriorate. Many instances, and we all know in our Caribbean society, some grandparents or some parents may not even be as close to the kids. And as a result, there's no connection there to begin with. But again, a son or a daughter may feel, maybe touched by divine intervention, that this is my parent, and whether I knew them growing up or not, I'm going to look after them. This is a challenge, Mr. President, and it's something that we have to address. I want us all in this Senate to divorce from the thought that aging is the only metric that we need to consider when looking at the elderly. Because if people are aging unhealthily, this is a huge challenge for a small island developing state like Barbados. It's not just managing diabetes and hypertension, although there are gaps in care there, but as another member has stated, it's all the other chronic conditions that come along with it, the arthritis, the dementia, the other forms of cognitive decline. Not everyone may be able to make it to the hot pot, but mobility challenges are significant. I have witnessed for myself people in my own family who are no longer able to go places or do things or feel safe to do them because of mobility challenges. But, Mr. President, they do not need to be in a long-term care facility. They don't. And I think this is a mistake where we assume just because someone cannot be 100% and that they're 70%, somehow they need to be in a nursing home somewhere. There are transitions of care. There are transitions of care. There are home units which are preferred. The preferred care is really in your home that you're accustomed to and you have your relatives around you. But you need to have the support structures in place. You can't be at home relying on National Assistance Board or whatever time come around or however frequent the visits are, or you can't be reliant on a neighbor to drop you to your appointment. If the society had these systems in place, then things would be a lot easier. I was reminded this morning as well, and I see Senator Reid here, by an elderly relative, that the other thing that patients or elderly people are at risk for is this digital divide that is occurring. I also lived with a parent who might also struggle with remote controls from time to time. But certainly, this new world of technology, and including artificial intelligence, is quite intimidating. And when we go about our development as a country and we adopt certain things like maybe cashier-less supermarkets or reduction in bank tellers because it's more cost-effective for a bank, the impact that has on an elderly person is significant. Many times I've visited, well, I don't visit the bank many times, but the few times I've visited the bank, I have noticed that the only provision made most of the times for the elderly person in the line is the kind-heartedness of someone standing, say, okay, you go before me. Or maybe they're directed to a chair or something. There's no structure in place. When you go to a bank or a supermarket or anywhere to conduct business, and you can prove, I mean, some people may not need to show an ID, but some proof that you're an elderly citizen, you should be able to be fast-tracked and receive service as a priority. These are basic customer service things that we should be considering. The care of the elderly cannot begin and end with government either, regardless of the government that's currently in office. The whole of society has to change, including non-governmental organizations and support that they must add in this space. I speak specifically to those in the health industry, but there are others. So, for instance, the Heart and Stroke Foundation of Barbados, which is the only center in this country that does cardiac rehabilitation, the only center in this country where there's cardiac rehabilitation, and they've extended it to stroke. Who would get prioritized? We tend to prioritize those younger individuals who we say are at the peak of their productivity years. We want to get them back out to work. But what about the elderly patient who has to wait weeks for the next physiotherapy appointment, and therefore they're never going to make the maximum recovery because it is not possible in the public setting and they can't afford private care? I started off by saying that this bill was driven by a burning platform, the COVID-19 pandemic. And I also wonder whether the policy will speak to possibly future pandemics. Because as we age and the non-communicable disease burden increases, our entire society becomes more at risk in an approaching pandemic. And so things like pivoting to online shopping or shopping assistance. There are some supermarkets, I am told, I don't go to the supermarket that often either, but inside of supermarkets, there's some supermarkets where there's someone assisting some elderly persons to collect groceries and even assist them in checking out, those kind of things. But again, it's sporadic, it's not structured. Those kind of things need to be part of a system. I should be able to go on an app, Senator Reid, and say, listen, can I make an appointment to come to supermarket X on this day? Tell me what time so I can have a shopping assistant to help me to get my stuff sorted. And maybe some kind of public transportation besides a ZR to get to and from that place. These are practical solutions that we may think, because we are not elderly, are small yet, if we're fortunate. But the impact this has on the elderly, or the impact these have on elderly patients or people, is significant, significant. I'm going to close by pointing the finger directly at some institutions who I think need to be more involved in the conversation, beginning, of course, with my own, the University of the West Indies. The aging metrics that are used to predict how social determinant systems or social support systems change will need to be revisited, will need to be modernized. We can't just be counting what percentage of people are over the age of 75 or how many people are in a clinic. Or we have to look at what are the needs of this aging population and use predictive analytics to suggest how are we going to change our society to accommodate them. The challenge is out there to the university, those of you listening, to construct and design appropriate studies that influence national development as it relates to age and the aging population. And of course, training. I developed a love for geriatric medicine when I was a medical student. And a previous member of the other place was a geriatrician. And I did not know that years later I would be practicing geriatric medicine by default because of an aging population. But there's no geriatrician currently in public service. How are we leading the charge of healthy aging if we don't have the number of experts there? So again, the challenge to the university, training in geriatric medicine and gerontology so that we can have a cadre of doctors, nurses, and other healthcare professionals who are trained to meet this need. And this doesn't have to be long specialty training, but even short courses could be done to sensitize staff at a basic level to interact, and then top-up courses as we continue in community services. The policy certainly describes a well-written, well-researched, and well-referenced roadmap of getting to where we want to get to in 2050, when many of us in here will be elderly and experiencing life in that part of our journey. My fear, however, is that we miss critical opportunities to identify what are the gaps that we need to get right. Who are the stakeholders we need at the table at this time to implement changes? And more importantly, how will we collect and use data intelligently to forecast changes down the road? And so, Mr. President, with those few words, I conclude my remarks. Thank you.
Thank you very much, Senator Dr. Connell. Senator, the Honourable Christopher Maynard.
Thank you, Mr. President. Mr. President, I, at this late stage in this session of Parliament, would like to congratulate the government, sir, on a program that it ran during the COVID-19 pandemic. And it was called, I think, Seek and Save. It was, I will not call it brilliant. I will not call it brilliant for one reason, which I will not say, but it was an excellent program. Sir, for the first time in my life, it was a time when Barbadians were confined to their houses. And it provided a perfect opportunity to gather data. Senator Reid will understand this very well. Hopefully, in my lifetime, there will never be another time we will be confined to our houses like that. But it was a program that involved a significant number of players numerically and groups, and the University of the West Indies participated. And young students, some medical students, participated in gathering the data. And I dare say some were suitably rewarded when the government gave national awards at the end of the pandemic. Sir, with your permission, I want to read one item, sir, in this resolution. And it says, whereas the government of Barbados recognizes that by 2050, 1 in every 5 persons will be over the age of 65. That, sir, is not a frightening statistic. It's a real one, sir. I have crossed that 65 bar, sir, and I suspect if you have not done so, you soon will. But, sir, it tells the country what we can expect in the future. And, sir, Senator Connell spoke of the involvement of the University of the West Indies in this rather long document that was well researched. And he's right. But it predicts, sir, some things for this country that if you look back at some of the events of this week already might frighten us. Sir, it speaks of the rising numbers in the older demographic in Barbados, 65 plus. But the age, sir, for me, is not the focus. It says that for Barbadians, there has been an increase of 2.3 years in life expectancy from age 60 between 1990 and 2017. That is excellent. However, the healthy life expectancy during the same period has only increased by 1.6 years. So people will live longer, but not healthier. That, sir, is a burden. That's a predictable burden. So while we can be happy that in the future we might live longer, we have to start thinking about how will we provide for this longer life in a less healthy state. And can a government do anything to reduce some of its long-term costs by putting some money up front? And I think, sir, that I some time ago spoke in this chamber, most likely during an appropriations bill, about the importance of purchasing and allowing medications that might reduce complications from a chronic, non-communicable disease that might cost more than the cheaper ones, but the long-term benefits will more than offset the costs in the future. And, sir, that clear statement, probably to my mind, backs up that statement, that if we can predict something is going to happen and we can possibly prevent it, or rather something unpleasant will happen and we can prevent it, then we probably should. But sir, it also said that in 1990, 2000, and 2010, the population census reports for Barbados revealed a 17% increase in the size of the 65-plus segment of the population. Not the under 15s. We weren't having babies. We were just getting old. So when we came to this chamber, sir, relatively recently, and had an amendment to the National Insurance Act, and earlier on we spoke about my colleague, Senator Worrell, spoke about a wonderful possibility of retiring at age 60. I asked, how? How will we retire at age 60? What will we find in the ground in Barbados that will make this country very, 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 very wealthy? And we have a national fund that will give people large retirement pension plans and allow them to retire at 60. Sir, it's not going to happen. We have to be realistic and accept where we are and do the best that we can to keep people healthy. But sir, in that same statement, it said that the share of older people over 65 relative to the population has increased 11.9% to 13%. It means that the Barbados Drug Service, if our rate of chronic non-communicable diseases remains the same, the Barbados Drug Service can expect almost every year to spend more money on buying drugs and paying for drugs just to sustain people. Not to stop what is happening, just to sustain them, sir. So, I glimpsed at a newspaper, I think it was today, and I've seen this thing before, where someone proposed that we should increase the taxes on soft drinks. And having read this document before, I thought, well, I wonder, I didn't check to see the name of the person who wrote it, and I wondered, I said, well, maybe that person is thinking right. Because if we know what some of the things that might be causing harm, and we can reduce the consumption either by force or convincing people not to do it, then we should. Sir, one of my late colleagues, a gentleman called Dr. Tony Gill, I met him as a medical student, and I must admit, I apologize, that I thought that he was, I wouldn't say a nuisance, I thought he was difficult. Because he came to every conference and he fought about stopping people from smoking in public places. And if you wanted a bathroom break, sir, you would go out when he was going to speak. But I recently had to admit at a meeting that this gentleman, with that constant fight, got all the bans that we now have in place. Maybe somebody, maybe some younger person, not myself, I don't have enough time left for it now, needs to start that fight with the chronic non-communicable diseases in every forum that they can. Because this noise, this constant fight, seems to eventually get people to change. If we only produce policy documents and the public at large do not hear the details, do not understand what it really means, and it's not explained to them, we'll be in the same place 30 years on having the same document, sir. I thank you.
Thank you very much, Senator the Honourable Christopher Maynard. Senator Anne Boyce.
Good evening, Mr. President. Thank you for recognizing me. I stand to support the resolution before the chamber, Mr. President, because I think that the policy attendant to the resolution is critically important at the time that we discuss it. So I would wish to begin by commending the crafters of this national policy on the elderly, because I think it is a comprehensive document that, if followed and if every Barbadian takes heed of its contents, Mr. President, we would be in good standing. There are indeed contained in the resolution and in the policy some stark realities, and some of my colleagues have treated to them. The issues around population and the questions, the general question, Mr. President, about whether Barbados, with its limited resources, has the capacity to carry the extraordinary weight of an aging population and the multiple interventions that will be necessary, Mr. President. Sir, I encourage us, as stark as the reality is, and perhaps because it is stark, I encourage us to treat to the question with maturity and to treat to the question with sobriety, which we have done here today. Because contained in this document and bound up in the multiplicity of challenges that face Barbados in this regard are really quality of life questions, not only for those Barbadians who are aged, but for all of us. And as I was reading the document, Mr. President, I began to ponder on the question of what Barbados would and could be like, Mr. President, if indeed we heeded the calls, the multiple calls within the document. Let me say that even in the context of the stark realities around the aged and aging in Barbados, that this government is taking extraordinary steps to alleviate the worries and the concerns of that population and those who care for them, sir. And as I say in here all the time, I am both struck and impressed by the reality that we do not consider this in a vacuum. This policy, as you're well aware, exists alongside disability policy and the Rights of Persons with Disabilities Bill. It exists alongside broader interventions, Mr. President, in the social services sector aimed at bringing the services closer to the people and certainly increasing the efficiency of the traditional agencies through an amalgamation of those traditional agencies into a single amalgamated social empowerment agency, Mr. President, with satellite offices across the island. Just last week, we saw the opening of the first one at Six Roads, and there will be others opening in short order. And I say that to make the point, Mr. President, that this government is serious about the interventions it makes in this space. it is serious about the interventions it makes in this space, sir, because the generation of Barbadians who are aged and aging, well, we're all aging, but aged and aging, have contributed immeasurably to this country. And we have the responsibility as younger Barbadians to care for them. And not only to care for them in the kind of paternalistic and traditional way that we often think of care, but also to create the enabling environment, Mr. President, for their continued flourishing and for their continued active participation in this society. Mr. President, it is why the government of Barbados is constructing has created rather, the elder care program that some of my colleague senators have spoken to in this debate. A program that permits individuals to go into homes and to assist, particularly those individuals, sir, who do not have the benefits of persons living with them and actively caring for them and others. And this is an extraordinary help, Mr. President, particularly for those who are caregivers for persons who are older, because some of us exist in the sandwich generation. I think Senator Dr. Connell referred to it in his own remarks. That generation of Barbadians who are sandwiched between our grandparents and the children that would help to alleviate some of the challenges around population, Mr. President, and the extraordinary weight, I don't want to use the language of burden, but the extraordinary weight that creates for individuals. And it is those kinds of interventions that help to fortify the care economy and the scaffolding around care, Mr. President, so as to permit, or rather to dissuade individuals from neglect in the face of that extraordinary weight. In that same vein, Mr. President, the government's plans to construct a facility at Sterling for the care of, for daycare facilities. I don't always like to use that term, but daycare facilities for, respite facilities rather, for persons, for the elderly, Mr. President. Because again, the weight of having actively participating in your professional endeavors, but having the responsibility of caring for an elderly person, Mr. President, is extraordinary. And this government recognizes that. I think the facility at Sterling, which was announced in recent weeks, will be the first such facility since the Vauxhall Senior Citizens Village, Mr. President. And no doubt, given the stark realities of contained in the policy, something that we absolutely need. And so I think that the government ought to be commended for that. And commended for their commitment broadly to building these kinds of facilities and initiatives so as to assist the younger generation with our care responsibilities. Sir, many of my colleagues, Mr. President, spoke tangentially to the issue of Alzheimer's and dementia. And I was pleased as I was reading the report, sir, to see a commitment by the government to ensure greater attention to the area of Alzheimer's and dementia, Mr. President. A recognition that the realities are stark and that for a long time, Mr. President, we have been very quiet as a country about this disease. We've been quiet, Mr. President, to the point where sometimes it feels as if we just accept it as a part of aging. We just accept that our grandparents and those older than us will come to forget. But I think, Mr. President, that we need greater awareness around the disability, around the condition. And in saying that, I do recognize the extraordinary contribution of the Alzheimer's Association to Barbadians' understanding of the condition. But I certainly do look forward to more and better investments in public understanding around the disease. By that same token, Mr. President, I think that the time is now that we develop a national plan around Alzheimer's and dementia with specific focus on increasing the capacity. Senator Dr. Connell referred to gerontologists earlier, to neurologists, certainly neurologists and other professionals who can aid in the care of persons suffering with or living with dementia and Alzheimer's would be an important investment, certainly as we animate this national policy. And I talk about this, Mr. President, from some personal experience. I've spoken in here before about the extent to which I'm a grandmother's boy, and we recently, just a couple months ago, buried her, and it was Alzheimer's and dementia was a disease she lived with in the latter stages of her life. And so I happen to know well, Mr. President, the realities of caring for someone with the disease. And I think as a region, but certainly as a country, we need to invest in both the public understanding of the disease, but also in the kind of scientific investment and care for the disease, because it does not appear, I'm not a scientist, Mr. President, but I think the data indicates that it does not appear that it is going anywhere. And so I think we have to match our investments, things like the National Development Scholarship, things like other investments across the health sector in not only care for Alzheimer's and dementia patients, but an understanding of the disease, Mr. President. Because the prevalence, it certainly appears to be reaching an extraordinary amount, and we need to do something about it in a concentrated and implementable way. Mr. President, I wanted to address this notion of the digital divide, and because we appreciate the extent to which the e-commerce activity, the digital environment, is a place that is ubiquitous at this stage. It is everywhere, and persons who are older must indeed participate in it. I spoke earlier about the wonderful interconnectedness of national policy in the social services space, and as we were developing the national policy on disability and the law, we spent considerable time ensuring that there were protections embedded in that legislation and in that policy to ensure that digital services were accessible to persons with disabilities, making the country really and the private sector commit to that accessibility. And it is important, as is evidenced by this national policy, that those accommodations are present for persons with disabilities and present for persons who are older, and that we invest in them as well. So that things like the digital accessibility tools and rules that ensure that a person can navigate their e-banking with ease, or that government services are accessible to persons with disability. I keep saying disabilities. I presume naturally, because there's sometimes a nexus between the two things. But it are accessible to the elderly, because sometimes one of the ways in which persons can keep their minds active and continue to contribute to society is through the carrying out of their ordinary business. And we have to commit, Mr. President, to making these tools available so that government services, certainly our commercial banks, and certainly in the Ministry of People Empowerment and Elder Affairs, we're having a conversation with our commercial banks around this, so that the tools that we come up with in this area and the guidance that we provide will no doubt contribute to the accessibility, continued accessibility for persons who are older. Mr. President, I do not intend to be long, and so I will end by, as I began, by commending the government of Barbados, by commending, permit me, Mr. President, to say the name MP Cynthia Ford, by commending Professor Dwayne Devonish for their contributions to that which is before the chamber today. I hope, Mr. President, that Barbadians will take the opportunity to read it, to imbibe it, Mr. President, and to live it, and to animate it in their interactions with older Barbadians, Mr. President, because their quality of life improves our quality of life. Mr. President, I'm obliged to you.
Thank you very much, Senator Andrelli Boris. Senator John King. Senator Cummings.
Mr. President, thank you very much. I want to express appreciation to all of the honourable members who have spoken and who have contributed in no small measure to the policy in the first instance and the debate here today. Senator Worrell, in his contribution, made a number of strong points, and certainly I think all of us identify with the idea of a grandmother, a great-grandmother, or elders in our communities, but more importantly, keeping our elders in our homes. Dr. Connell and Dr. Maynard, Mr. Maynard, spoke with not a small amount of medical expertise, and we appreciate their inputs, and the same for Senator Andrelia Boyce, who just spoke. Mr. President, this has been a full day, and with these few words, at this point, I beg to move that this resolution do not pass.
The question is that this resolution do not pass. Those honourable senators in favour, please say aye. Aye. Those against, please say no. Methinks the ayes have it. This resolution is now passed.
I know. Mr. President, I thought you were going to...
Yes, please. Mr. President, we refer to announcements by Your Honor the President.
But we have announcements and to inform you of a message which I need to send to the Honourable House of Assembly in relation to our small adjustment to the Tourism Amendment Bill. And it reads as follows. Message from the Honourable the Senate to the Honourable the House of Assembly. The Honourable the Senate has the honour to inform the Honourable the House of Assembly that at its sitting on Wednesday, the 14th of January 2026, the Tourism Levy Amendment Bill 2025 was amended in the following terms. In Clause 1, the word 2025 was deleted and the word 2026 was substituted therefore. And the Honourable the Senate transmits the amended bill to the Honourable House of Assembly, inviting concurrence in the amendment to the bill, dated 14th of January 2026 and signed by me. And that's, of course, a timing difference between the House dealing with it in a few weeks ago, 2025, and now 2026, so we have to make that small technical adjustment for purposes of regularity. So please be aware that this will go off in our name to the Honourable House of Assembly.
Presentation of papers recommitted.
Senator Cummings.
Mr. President, there are a few documents that I must lay today. First, the Barbados Economic Recovery and Transformation Plan, BERT 2026, the Civil Aviation Unmanned Aircraft Systems Regulations 2025, the annual reports and audited financial statements of the Barbados Tourism Marketing Inc. for the years ended March 31st, 2021 and March 31st, 2022.
We revert to public business.
Senator Cummings.
Mr. President, that brings us to the end of government's business for today, and I beg to move that this sitting of the Senate be adjourned, sine die.
The question is that the Honourable the Senate do not adjourn, sine die. The Honourable Senators in favour, please say aye. Aye. Those against, please say no. The ayes have it. The sitting therefore stands adjourned, sine die.